Hey everybody, Rich laying down here outside the world famous bunker in our house with all the good stuff in it, except for some of the good stuff I've got here right now. You know, the other day, which you all should be doing also, we started going through our biannual check of all our different kits and to make sure that we didn't steal anything out of it over the winter and didn't replace it, which I normally have like a clipboard that if I take something, I write it down. So when I go to the store, then I resupply it and I know what bag it came from, which is something you all should be doing too. Because let's face it, we could take stuff out and then, you know, it's kind of like when your kids say, hey, are there any Cheez-Its? And you go to them, well, did you eat the last ones? Yeah. Did you put it on the list? And they just give you that dumb stare and you go, put it on the list and then I'll buy it. But that's kind of like, you know, with your prepping stuff, you'll use some of the stuff in your car. You should be going through your car kits now that it's getting to be summer. You're going to change out some of the stuff, obviously. And there's that weird in-between time you might want to have both your summer stuff and your winter stuff in your car kits and stuff. But anyhow, so we were going through some stuff, and my wife was with me, and she goes, what's in that little blue shoe box? And I go, that's our do-it-yourself emergency dental kit. She goes, emergency dental kit? I go, yeah, it goes with us everywhere. I says, it doesn't, I says, camping, wherever we go. If we go on vacation, we've got it. It's always here in the house. We've never had to use it. I said, when I go camping, I don't take all of it. I take a very small supply of it, but I have a big kit just to have it at home in case we need it. She goes, oh, well, what's in it? So I went through all the stuff and told her what was in it and everything. She goes, did you ever make a video on it? Apparently I had a very dumb look on my face, and she goes, huh, 288 videos and you haven't done a video on probably one of the most important things, because if your teeth are cracked or you lose a filling or your mouth hurts, the day sucks. It's horrible. You can't eat, you can't do anything, you get headaches and stuff like that. She goes, and you didn't make a video on this? I go, okay, I'll do it tomorrow. So here it is, it's tomorrow, and here's the video. This is, and everybody should have at least portions of this. And like, you're gonna say, Rich, I've got that, I've got that, I've got that, but you know my theory is that, okay, so you've got this part in this bag, this part in that bag, and then the rest of it's in this box or this bag. Do you have all the bags with you? Do you want to go searching through everything? So the first thing you're gonna say is, Rich, I've got most of that stuff. I says, yeah, but do you have it put together in one kit that you can access immediately? You can just grab and go. Or on your list when you go on vacation or you're going camping or something, that you can grab it, and not have to affect anything else. And let's face it, it's always good to have a backup, if not a backup to the backup to the backup, kind of like the stockpiling, 3 deep stockpiling, so that you have it and you don't run out of it. 3 deep, depending on how fast you use it, I mean, that's months of supplies, like mustard, ketchup, stuff like that. So anyhow, here it is. Let me show it to you. This is not very expensive, seriously. I'm gonna show you some stuff, and I probably have, if I can remember right, 60 bucks, 80 bucks, something like that, invested in this kit, not including the shoebox, of all the stuff that I'm gonna show you here today. So we're just, I've got my list here too. So let me go over it, and hopefully you'll get the bug to put this together. Right off the bat, anytime you don't feel all that good, obviously Tylenol, ibuprofen, I like Aleve, personally for me, but have this in the kit, okay? Because that's gonna be your first line of once a tooth starts to bother you or it's cracked or whatever, is get some pain meds in. The second part is clove oil. All right, there's 2 types of clove oil, external and internal use clove oil. This is internal use clove oil and cotton balls. Unbelievable. I played 40 years of hockey, and my teeth are trashed, so every once in a while I'll have an issue with the filling and stuff like that. Plus I wasn't a very good brusher when I was a kid. Hold on a second. wasn't a very good brusher when I was a kid. Heater. So my teeth weren't great to begin with. Clove oil on cotton ball, on the place where it hurts, along the gums. Unbelievable. You may even want to start with the clove oil first. And then if you need to go to the Tylenol or ibuprofen, which would probably be good for night too, because you're not going to put this on unless it wakes you up. Clove oil. All right. Now, obviously there's commercial grade, like Ambisol is really good for your teeth. That'll numb the pain and stuff like that. All right, so now, and you should always have, if I would secure the box or the bag, that stuff wouldn't happen. I always have an extra set of toothbrush, floss, picks, and stuff like that in this kit. Always. Have it with you, have it there, have it available. Something else you should always have with you, a good antiseptic mouthwash. This just happens to be Listerine. Doesn't have to be Listerine. But this is an antiseptic. It's good when, you know, whatever's going on in your mouth, that you keep your mouth nice and clean. So now let's get into a little bit deeper. Let's say you've lost a filling, you cracked a tooth, the crown came off or whatever. You need stuff. This is, oh, I forget what they call it. I've got the thing here. But this is like a little quick fill kit. All right. So this is like a putty. And this is just a little tool that you can actually put in the tooth, you know, and fill that up. But what you're going to want to do before you fill it up, you're going to want to rinse it with saline. So here's saline. Here's a syringe. You can pick these up. If you don't have kids or grandkids that need medicine, because a lot of medicine comes with these syringes, you can go to Walgreens, Osco, CVS, Rite Aid, or whatever, and just ask the pharmacist. They don't sell them really. You can just ask the pharmacist, hey, you know, got any medicine syringes? And they'll probably give them to you. If not, it's a couple bucks for these. So you've got that. You're also going to want masks, okay, for you, you know, because you're really close to the patient. This is not a COVID thing. This is an anything thing, you know. You don't want what's in their mouth in your mouth. If when they're working, they sneeze. When you're working on them, if they sneeze or whatever, you definitely want a mask. Eyewear, okay. Gloves, because you're going to have your hands in their mouth. And since you can't see inside there because it's really dark, you're definitely going to want a headlamp, okay? Headlamp, because you can't hold on with a flashlight, and you don't want to have somebody holding over your shoulder, you know, with a flashlight. Headlamp, you know, right in the mouth, you can see everything that's going on. But that's just, you know, say you've, you know, cracked a tooth, you can clean it out and stuff. Something else you can have, and what most dentists use, I don't have it here. I actually have it in the room, but canned air. All right, you know, what you use for your iPad or you know, your laptop, or not your iPad, but your laptop or your computer keyboard or whatever, to clean dust out of the keys so they work better. You probably want to use that, get in there and dry it out a little bit before you put this this filling stuff in. Probably be a lot better. I mean, that's what dentists do when they do a root canal or whatever, and they put a temporary filling in. You know how they with the air, and then they pack in the filling for the temporary filling. But what if it goes beyond that? Okay, and some of these tools I'm going to show you right now. This is German made, 30 bucks. Okay, and it's unbelievable. And some of these things you're going to want anyhow, no matter what kind of repair you do. But you've got picks, you've got the mirror, you've got the different types of forceps to pull, there you go, to pull a tooth. Because a lot of times, I mean, that's the way dentistry used to be. If you think back, barbers used to be the dentists, and that's why they had the candy stripe pull on the outside. It mimicked towels with blood on them, and that's how people knew that they could go over there for a dentist. They didn't like do fancy drilling or anything like that. They pulled the tooth, and even though it was pain in the beginning, it solved the problem. That's what they did. Barbers pulling your teeth way back in the Wild West era, and probably long before that. So this is a kit. It's not very expensive, but it has everything you need. It's got the picks. You know, how many times have you heard somebody say, "Oh, I've got something stuck in my tooth and between my teeth and I can't get it out, and floss won't get it out." You know, popcorn's great for that, right? There's picks in here where if you can see the piece and you can slide it out, okay? Somebody chewing on a toothpick or something and gets, you know, a piece of wood stuck in there, you know, you can pull it out. But then you also have the 3 different types of extraction tools, because you don't just use one, because they're used for different areas of your mouth, different teeth. So basically, that is the DIY dental emergency kit that we have put together. It's really nice to have. It's great for emergencies. Have not really needed to use it. I have a cracked tooth right now, but doesn't bother me. If it's like some of my other teeth from hockey, they're just hanging in there dead. But if you played hockey, you know exactly what I'm talking about. Or rugby. Hockey or rugby. About the same. One's on ice, one's on grass. So that's it. Let me turn through the miracles of technology. Let me move this around, you know, and get this down so you can like take another look at what we got going here. Just to oh, I did forget something. Holy cow. Looking at this kit, I did forget, obviously, sterile pads you're going to want to have. That's great for sopping up blood, temporary packing. They can, you know, if you have to pull a tooth, you're going to fold that up to a nice little square, and they're going to bite on it, okay, until it can form a clot in that area, and then it will stop bleeding. You can just get rid of that. If you've ever had any work done in your teeth, you know that that's exactly what they do. Or they don't normally use cotton balls because they're too fibrous. They'll use a gauze pad. So really, going over this again, obviously you have your toolkit. You have your filling. Can you even see it? Oh, filling repair stuff with your little tools. You got your ambisol. You got your mask, gauze pads, Tylenol, ibuprofen, depending on, some people can't have Tylenol, people can't have ibuprofen. Your clove oil, all right, internal clove oil, your headlamp, your syringe, your saline solution, your antiseptic, eyewear, gloves, and then just an array of stuff for your teeth to clean them up. Obviously, you want to clean after anything is done in your mouth. Just to clean it up. So it's a neat little kit. It has not come, I have not needed to use it per se anywhere, at home, away, camping, on vacation, thank goodness. But you know, you've got all your different tools here that you can use. You can actually check out videos on YouTube about how to use them and stuff. Like I said, this is a really good German toolkit. And it wasn't that expensive, to be honest with you. So, but that's it. I mean, that is your DIY emergency tooth kit, tooth repair kit. So think about it. If you're smart, you'll put it together, because it just, we've all had tooth problems. We've all waken up or we crack stuff. Went to a restaurant one time and bit into a piece of bread, the first thing I did, and cracked a tooth in half. And actually didn't have anything with me. But, you know, I powered through, no problem. Obviously, you can tell that I'm not starving to death. So it was fine. But had I been somewhere that I couldn't get to a dentist, you know, within 48 hours, I would have been in big trouble, and this kit would have helped. So that's it. Thank you very much. Subscribers, thank you all so much. If you're not a subscriber, this is where the cool stuff, like if I went like this, you'd see subscribe. Over here, ring the bell would come up. those of you that have been with me long enough know that I am not tech savvy at all. Matter of fact, half the time I can't even use my clicker to turn off the video. So, but hey, I'm old. I'm 65 years old and still kicking though. Matter of fact, I'm gonna go out and work on our survival garden today since we finally have sun and the rain stopped here in the Midwest. So I'm putting our survival garden, which that is a video coming up probably, might even make it on Mother's Day. Might even have the wife in the video. No, she won't go for that. So anyhow, thank you very much. Please put this kit together or some of the kit together. Maybe if you don't want to, extract teeth, maybe making sure you have Tylenol, ibuprofen, clove oil, Ambisol, a temporary filling, and some of this other stuff just in case you need it for you, your kids, and your grandkids. So that is it. Thank you very much. As we always say when we leave, be aware of your surroundings no matter where you're at. Also, have enough food on hand should you have to evacuate or, which is more likely, shelter in place. And that's another good video, why you won't bug out. And please, prep like your life depends on it because we all know it does. Your life, your family's life, maybe your neighbor's life if you like them. Take care. Bye.